Good evening, everybody. My name is Andy Manos. I'm a PA here at North Star Vascular and Interventional. And tonight we're going to talk about why your legs feel heavy, achy, and tired, and perhaps they do right now, and things you can do about it. So simple solutions for a very common problem. If this sounds like you, if you have heavy legs, aching or throbbing, especially in the evenings, swelling of your legs, both of them or even one of them, and visible ropey veins, then this is for you. This discussion is for you. You might have varicose veins, and we're going to talk about that, what that looks like here shortly. All right. It's not just cosmetic. So a lot of people get these bulging veins and they look kind of ugly, especially in summertime. The weather's getting nice. You can see the ropey veins when you wear your shorts, but it's more than that. Oftentimes there are some symptoms that can be really uncomfortable. It's not just about the way that they look. So this is a real circulation problem. Blood is not exiting the leg like it should, and it tends to get worse over time if it's not treated. So here's a couple pictures about varicose veins. Your veins are supposed to return blood to your heart. So the veins in your legs are supposed to move blood up. And to do that, like to combat gravity, veins have valves in them. And that's what we rely on to shift blood up a segment and then continue with the blood up and out of the leg and into the heart. And here's a few pictures. And varicose veins is basically the breakdown of that valve, which then allows blood to go backwards. Your legs are working against gravity all day, and over time, whether it's genetics or occupation that requires you to stand all the time, these valves can become incompetent. So we rely on this one-way system, which involves valves, and if the valves break down, that increases pressure and can lead to varicose veins. So those valves, like I said, they keep the blood moving in one direction, up out of the leg. They prevent blood from going back down. And when they work, you never notice them. But when they don't work, you definitely notice them. So this is where the problem starts. The valves, they stop closing properly. The blood starts to go backwards instead of moving up. And when that happens, pressure builds up, like we talked about, and that's what leads to our symptoms. So what are you going to feel? Well, because the blood can't exit, your leg is holding more blood, and you could feel the heaviness and the deep achiness, maybe in your calves or even in your thighs. They will become swollen, so managing swelling, the body should be able to get rid of the waste product from the cells working in the leg through the bloodstream and out, and if there's a problem with that blood getting out of your leg, it can result in swelling. We hear a lot of patients talk about restless legs at night. And restless legs can be a sign of varicose veins. So if you have noticed that you have restless legs, if your spouse has noticed that you have restless legs, and you also notice you have the bulging veins, it could very well be from that circulatory problem. So if you spend all day standing, like a waitress or a nurse perhaps, and you could have these symptoms by the end of the day, and oftentimes they're going to be improved by between 6 and 8 hours of laying horizontal where the blood is able to completely exit the leg. So it'll be better in the morning, worse in the evening. And movement oftentimes will help. If you went for a walk the dog after work, for instance, you may notice these improve, but it doesn't fix it. It does usually get worse on its own. So this is something that isn't going to just get better. And some people, there's a few things you can try to keep it at bay, but you're rarely going to be able to reverse this. So over time, the symptoms will probably increase and worsen. And it can start as what you'd think as a spider vein, or what we would call a reticular vein, which is a really tiny, just rope of purple on the skin, can be one of the early signs that those peripheral veins are increased pressure. And then slowly that can turn into more of them. And then, or you would actually, a lot of people can get that on the inner side of the ankle. And then you might see the bulging veins that we're used to in varicose veins. So that ugly bulging vein that looks like a little worm under your skin when the veins become more visible. So it will progress. But there's some good news. So we can fix the source of the problem and take care of the veins. It's not just the appearance either. So what we will take care of the problem, which will take care of the symptoms, which will take care of the appearance. So let's talk about that. Okay. So your veins you have the veins in your leg are like escalators. I like to think of it like the airport, but you have some deep veins inside your leg that is mainly responsible for moving the majority of your blood out of the leg. But the veins we're talking about here are superficial or close to the surface. So they're smaller escalators, or let's just say that they're not as wide, or they can really only handle one person without luggage. And they're supposed to be bringing the blood up and out of the leg and step by step, just like an escalator. And when the valves fail, it's basically like the escalator breaks and it's no longer going up. And if you have people on every step and those valves are broken, it almost might even shift backwards. And now we're going to have a huge line of people at the bottom of the escalator, and that's that increased pressure. And because those valves are broken. So now everything's going backwards. That backward flow is what causes the symptoms, the heaviness, the swelling, and the visible veins. So what we do to fix it is we don't fix the escalator, actually. We fix we block that escalator, and we force that line of people that has congregated at the bottom, which is blood in this case. We actually force them over, or to a different escalator that can accommodate and is working well, and that easily takes the people up and out of where we're located, so that decreases the pressure. So to treat varicose veins, you shut down the small, narrow escalator, the one that's broken and sliding backward, which is going to force people in that analogy, or blood in this case, to take the escalator that's working, and those are your deep veins. So the treatment around varicose veins is really primarily to actually block the vein. That's the issue. So it forces blood to the deep vein so it can easily exit the leg, and then the pressure is relieved, and that's what makes the symptoms and the bulging veins go away. Okay, so how do we do that? So there are minimally invasive procedures. You don't need to have your veins stripped. A lot of people hear that term. There are many other things that can be done in the office. We don't have to use general anesthesia. You can go back to normal activity, if not work, the same day in some cases. And how we do it is we just have to close down that vein, close down that escalator. And here's a few pictures of a few of our techniques here. Multiple tools to do it. The right one depends on the patient, depends on the anatomy, depends on the symptoms, depends on which veins are involved. But it all is aiming to solve the same problem, and that's going to be to shut down the vein that's at fault, the faulty vein. So one way to do this is going to be with heat. So you're going to use a type of energy that's going to irritate the vein and cause it to kind of scar down and close. And those two methods are radio frequency ablation and laser ablation. So you're going to ablate the problem vein, which will immediately cause it to close. And that's going to be, it's going to help. The vein can no longer take on blood. The blood goes to a different place and out of the leg, and the symptoms will go away. So this is very effective. It's very well studied. It's commonly done, and it's a good option for many patients. Growing in popularity is this one, which is actually using an adhesive or a super glue, you can think of it as, that's going to glue the vein shut. It happens almost instantly, and there's no heat. It's minimal discomfort. This one is nice for several reasons. You don't the recovery or the restrictions afterwards are less intense. You don't have to have compression stockings. So this one can work. This one may not be a good option for somebody who has hypersensitivity or many allergies, because you could react to the glue itself, and then that's not very fun. So perhaps if that's the case, we would choose a different option for you. Again, it depends on patient preference and patient history and anatomy. You can inject directly into the problem veins with what we call sclerotherapy. So I like to think of it as a detergent or a foam, and it's going to chemically irritate the vein so it can't take blood anymore. So we use ultrasound like this picture here, and you can just start an IV into the problem vein, and you watch with ultrasound as you fill that vein with foam and let it sit there for a few minutes as it irritates the vein and causes it to scar closed. And this is phlebectomy, so this is the most surgical because there will be many stab incisions. We call them 2 millimeter-ish, 3 millimeter-ish incisions along the course of the bulging vein, and then the vein is kind of hooked, brought to the surface, and then removed. And you can have several of those. This one is closer in line with the stripping. And there's really certain instances where this is the best option. Less and less people are choosing it because we'll be more and more successful with the other ones that we already talked about. But no stitches are needed to heal the skin, and immediately the vein is gone. So when you walk out of the office, that vein is gone. So that immediate cosmetic improvement. So what are you going to notice after one of those treatments? You are going to notice that your legs feel lighter, especially at the end of the day. There should be less pain, there should be less swelling, and you shouldn't notice the ropey veins. Almost every patient we see in follow-up says they wish they would have had it done sooner. They probably have been dealing with it for years and then recognized it was probably scary to come and have a consult or go through a medical procedure. But then as they see the procedure is pretty straightforward and the healing process is pretty quick and painless, almost everybody says they wish they would have done it sooner. Okay, so if any of that rings true to you, you should get checked if your symptoms are affecting your day. If you think about your legs or how full they are, or how swollen they are, or if you have to take Tylenol or ibuprofen, that's a problem. That means that the circulation problem is affecting your day, and it doesn't need to be. A great story about this is I had a gentleman who told me that he would shop at a certain grocery store because halfway through the store was a bench that he could sit on and just allow his legs to cool down. So he would walk through the store and his legs would be really full and heavy and painful. And then he would sit halfway through that grocery shopping trip and he would elevate his legs and let them empty for a few minutes. He said like 5-10 minutes, and then he'd be able to finish shopping before he got back into his car. So that is definitely affecting his day as he's having to plan his rest related to his circulatory problem, which happened to be varicose veins that were treated, and that was the first thing he noticed is, he didn't have to stop to shop anymore, which is exciting. So, if your veins are worsening, or if you have slowly watched them go from spider veins to a little bit more spider veins to varicose veins, you should consider a consultation with a vascular specialist. If you have persistent swelling, that's maybe you've been checked or is unrelated to other things, it might be time to have someone look at it. What are we going to do? So your first visit is simple. It's oftentimes going to be gathering symptoms. We're going to talk about what you've done, or just gather a detailed medical history, what you do for work and how much it bothers you. And then ultrasound is really our friend. So we will need imaging, but we do want to look at the veins on ultrasound, measure the size of the veins, look at those valves, measure the flow across those valves, and we can easily measure reverse flow, or flow going in the wrong direction, which has a term that's hard to read on your chart, but it is incompetent. That is the word you will see on your ultrasound if you have a problem with your valves. That just means your valves are not working, and they are incompetent. So if we will treat veins that have incompetence, those are our targets for the treatments. So we went over 4 different options of treatments, and no, you don't have to stress over that. That's kind of up to us, the providers, who are going to make the decision of which one's right for you. And like I said, we look at your ultrasound, we talk about your symptoms, and that's really what's going to drive the treatment. And sometimes it's a combination of treatments. A lot of times we'll do some combination of ablation of one of the veins and then some foam sclerotherapy of another one. Compression. A lot of you may have heard about this, right? Compression socks can be helpful. It's not going to reverse the course of the disease, and it's not going to fix the problem, but it can be really helpful. So compression is something you might hear, and even if you haven't tried compression, or maybe you bought a pair of compression socks from Amazon or Walgreens and worn them, they may not be what we call medical grade. So there's a certain type of compression around the leg. So the material has to be able to squeeze your leg at a certain pressure to be considered medical grade compression. That number happens to be 20 to 30 millimeters of mercury, which is the same unit your blood pressure is measured in. And you need to have tried compression for 3 months, and that's for insurance. We'll talk about that in a minute. But there have been many studies on this, and they show that it doesn't really work. It's not going to fix the problem, but it can help. So I would wear them, especially if you know you're going to be standing or sitting for a prolonged period of time. Compression can be your friend and just make you get through those days a little bit easier. But as soon as you take the compression sock off, that same problem is still there. And if you didn't wear it for a day, perhaps you could have some swelling and some heaviness. I have a question here. Do I have to try compression stockings first, and for how long? Okay, so that's a great question. Almost always, yes. There are a few instances where your venous disease could make it where you don't need compression. So if you had a bleeding event, like you kicked the coffee table and it just bled like stink for a long time because you had these veins that had a lot of pressure in them, then you could skip the compression. If you had a wound in your leg that just wouldn't heal because there's so much pressure in the veins, so it causes disruption in the wound healing, you could skip compression. But most patients are going to require a 3-month trial of compression stockings. So yes, most people have to try it, and for 3 months. Good question. Most treatments are covered by insurance. So this is something, actually, insurance pays attention to this one very closely, and they have pretty strict criteria. And it's generally well covered by all insurance plans, including Medicare. And the main thing here that's going to get is where insurance basically wouldn't ask any questions, is that affecting your life. So how bad is the pain? Are you taking medicine because your legs hurt because they're full of blood? That's a problem. So this is, that swelling and the heaviness, those are considered medical conditions. So this is a medical treatment for that. And yes, it happens to be a cosmetic component, but it's really treating the medical condition to improve those symptoms. So the insurance plan will cover evaluation and treatment. They do often require a trial of compression first, and we just talked about that, but the 3-month trial of compression is almost standard in all of their policies. But our team handles all that stuff for you. So we'll look at your insurance plan, we'll see what the requirements are, and we will make sure we meet them so we can get your procedure paid for. Here at North Star, we can do that for you. Another question here. Does my insurance cover it, and what's it going to cost me? Yes, so your insurance is going to cover it almost always. What is it going to cost you? That's a different story. That is going to very much depend on what type of plan you have. I will use myself as an example. I have this family plan. It's a high deductible, and I have had no health care yet this year. I'm likely going to have to pay my whole deductible for the treatment. The treatment can range between, let's just say, $3,000 and $4,000. And if I haven't spent any money on healthcare and my deductible is $4,000, I might get the whole bill for the procedure, which is $4,000 out of pocket. But that depends. So that's my situation. Again, our team would assess your benefits and be able to tell you what type of deductible you have and your co-insurance and your out-of-pocket max, so we could tell you what we expect your responsibility to be. Good question, but yes, it's covered by insurance. Yeah, I told you most people wish they would come in sooner. This is a very satisfying thing to treat because it really, people have suffered from this for years, and because of that cosmetic component, it is fulfilling when they can just kind of see that melt away and then know that they're feeling better. So I do like seeing patients, even at 1 month follow-up, they're already feeling better, and that's a fulfilling thing. And yeah, they feel better, not just because they look better, but they feel better too. So treating varicose veins is fun. So don't wait for it to get worse. Schedule your evaluation. We can tell you what you want, or give you a second opinion, or tell you what you might need, or how we would work it up, or get our opinion. Be happy to see you and think through that for you. Order an ultrasound, see what's going on in your legs, see which veins might be incompetent. Be happy to do that. So if this sounds like you, then that's your next step. So here's a QR code. If that'll bring you to our site, but vascular surgeons, any vascular place is likely going to offer varicose vein treatment. And there's no downside just for the consultation, just to know. Pretty common thing that we see. Okay, a few more questions here. So a question I see here says, is the procedure painful? What does it feel like? That's a great question. It depends on which one we do, but for the most part, it's not that painful, but sometimes it can be. So it's not that painful, but if your veins are irritated from us working inside of them, they can spasm and they get kind of mad, so they clamp down. And if they clamp down while we're working inside of them, sometimes that can be uncomfortable. It doesn't happen often, but it can happen. Typically it's done in the office in maybe an hour and a half, and you're out of here pretty quickly. We like to offer a light, it's not really sedation, like an oral anxiety medicine, Valium pill to just take the edge off of the nerves. But we do start an IV in your vein, and that's a needle, so there's some numbing medicine involved there. A very straightforward ablation of a vein in your leg. The most common vein is what we call the GSV, which is the great saphenous vein. Can be done very quickly and very easy and not painful at all. So the majority of them don't come with much pain. It can be complicated by several things. Perhaps we're having difficulty navigating all the way through the vein. Perhaps we need to start several IVs along the way. Perhaps you'll have some spasm, and all of those would then add to the complexity of the procedure, which you may feel. Good question. How much time will I need off work or normal activities? Okay, good question. Depends which type of treatment we do again, but the venous CO1, for instance, you'd be able to be on your feet immediately and be able to return to activity. And if you didn't have sedation, you could basically just do whatever you want. It also depends on what you do for work. After these the other treatments, the heat treatments and the sclerotherapy, we are pretty strict on compression. Are going to want you to wear that for 5 days, every waking hour for 5 days, very strictly, because that's just going to help keep the vein closed to predict a long-term result. So that may limit what you do. So we have given some people some days off work, depending on what their job is. If they are going to be on their feet and their venous disease was pretty bad, we might ask them to be off their feet for a few days just to optimize the result of our treatment. Yeah, how do I know which treatment is best for me? That's a good question. So I would have to, I want to know two things. I just want to talk to you for about 5 minutes, and then if I had an ultrasound myself, oftentimes the ultrasound for this, you guys, is takes a while, right? So you are going to lay flat, then you're going to have your feet above your head, you'll have your feet below your head, and to map the veins in the leg can be a long process, but it's really valuable to know which segments of your veins in your legs are working and which ones aren't. But we will need that on every patient. So if you are going to get a full assessment for varicose veins, the ultrasound, it can take time. It's like an hour per leg. If you had both legs, it might be up to 2 hours. What treatment is best for me? Well, that ultrasound is really going to tell us. Most of the time, what we do is we ablate the GSV in the thigh from basically the groin down to the knee, and that helps almost everybody. Occasionally, we need to do some of that foam sclerotherapy in some of the other veins. On average. So I don't know what's the best for you, but if I had to guess, common things being common, without knowing anything else about you, a venous seal, for instance, or gluing your GSV closed would probably work well. Oh, what are the risks? What are the risks? So the main risk would be that it comes back, right? So recanalizing, so we glue it shut, but perhaps more blood will find its way into it, and over time, standing in gravity, the blood kind of creates a new channel back through the diseased vein, and that's going to be a problem. That's going to be like people walking up the escalator that's broken. It's still going to slide backwards. It was never fixed, right? We just shut it down. We just put things in the way so people can use it. And that can happen, and that's a risk. It's pretty low risk. These procedures are pretty successful, definitely in the 90%, 95 to 98%, depending on which one we choose. So it's most likely going to work. Risk. So that would be one of the risks, that it comes back, or recurrence, we should say. Another risk that is very rare, but something that's always at the front of our mind as we're doing these treatments would be, we want to make sure we're staying at the skinny escalator. We don't want to mess with the escalator that's the big one that's working, that's carrying all the people. Those are the deep veins. We don't want any of our treatments to come in contact with any of the deep veins. So that's something that will always be at the front of our mind. And that would be the most serious, but also the most rare risk would be that our procedure caused a blood clot in your leg, which is not what we want. And it's very, very uncommon, but it's something that's always at the front of our mind. Yeah, good question. Another one here. Will the veins come back after treatment? Well, I hope not. They shouldn't. They can. You do enough of these treatments, you will find one that comes back, unfortunately, but most of them don't. Most of them are gone, and they're gone forever, and the blood reroutes and finds a new way. Now, when we reroute the blood, those veins that we reroute it to may become incompetent over time. So it's different veins that come back, same problem, different vein or different escalator. How soon will I notice improvement in symptoms or appearance? you will notice improvement pretty quickly. Depending on how bad your symptoms are, it can be within that first week for sure. You will notice the legs feeling lighter. You may not notice the ropey veins going away as quickly. That might take maybe an extra week or so, but almost everyone on the first month follow-up is very much notice the improvement in the symptoms. So how soon will you notice improvement? I think you will notice improvement in the first 5 days. I think you'll be able to say, oh, I can tell something is different. And then for sure, cosmetically, I would say about 2 to 3 weeks. What happens if I choose not to treat this right now? That's a good question. So nobody's forcing you to treat it. If it's something you can live with, that's totally okay. And there are things you can do to keep it at bay, not reverse it, but keep it at bay. And those things, walking is amazing for our veins. It's amazing for our arteries. I mean, 10,000 steps a day, 5 days a week. I mean, that's always all of our goals, but it's hard to do, but it will very much help your veins. Elevating your legs at the end of the day can be really helpful because you're basically starting that process of sleeping a little bit early or allowing the blood to empty on its own, even though your valves aren't working. So being intentional about elevating your legs can be really helpful. Compression and wearing that strategically or religiously can be really helpful to kind of keep your symptoms at bay. So if you choose not to treat it right now, maybe I would do some of those things to limit its progression or to slow down its progression. But this is something that will likely get worse over time. Okay, that's all that I have. I appreciate all the questions and interaction. If you have any questions about varicose veins or anything else, or want us to see you and tell you about what treatment is best for you, you can go to our website or call us here, northstar.com, and we'd be happy to check you out. Thanks for your guys' time. Have a good evening.